On behalf of the Congressional Hispanic Leadership Institute, thank you, Haleon, for supporting the CHLI Purple Line podcast. Greetings. Oh, I love to see you here, Jonathan.
It's always
How are
fun
you
to be
doing?
here. Good, Marianne.
Good.
It's great being here.
Well, thank you for joining us on the Purple Line. I know we've got a lot to talk about Haleon, but before we do that, share with our audience a little bit about Jonathan's story, like where you're from and what led you to Haleon here in Washington, D.C.
So, appreciate you, like I said, for having me. So, you know me, John Martinez. I've been with Haleon now for about 3.5 years.
Already?
Prior to this, it's crazy,
Wow,
right? You never
yeah.
think of it. So, 3.5 years now. Before that, we spun off, right, to become our own, corporate consumer packaging business. We previously were with GlaxoSmithKline, right?
that's
So
right,
GSK,
that's right.
so historically Legacy Pharma. We've since spun off. Prior to that, I was in Congress for about 8 years with Congresswoman Nydia Velasquez, who breaks my heart that she
I
announced
know,
her retirement.
she's just
But
announced.
you look back and you look back to members of Congress like her, Miss Ross Layton, and even Miss Roybal Allard, right?
Right.
They all
Right.
came in the same
Yeah, they
class.
did.
That's
They
crazy.
did.
So it's exciting to see what the next generation is going to look like. But it hit hard home. It was. I've seen her career, and I remember meeting her for the first time when I was like 12. And it's
Oh,
crazy to
wow.
have had the chance to work for her and be a part of
Now,
her
why
history.
did you end up working in her office?
So originally, I'm from Brooklyn, right? Brooklyn,
Okay.
New York. So I grew up with her, and I was placed in as a CHCI intern.
Oh, cool.
Back then. So, and I had taken on every role from intern to legislative director with that one member.
Yeah.
My bragging rights are I only work for one member of Congress, and that was the
Okay, that's
one.
good.
And
That's
so, she's got a special place in my heart. So
Yeah,
it's
no,
always a good time.
it's interesting you mentioned Roybal and Ross Layton because our chairwoman, Elena Ross Layton, she
Yep.
jokes around sometimes about how there was a time when all three of them were in Congress, and it's not, a secret that it's not very often that you see three Latinas
Right.
in Congress, and they're kind of the trailblazers. And she mentions how people would sometimes get them confused, and she's like, I don't know how you can get a Puerto Rican, a Cuban, and a Mexican confused, but
Right.
but they
Right.
did.
Yeah.
So kind of an interesting time.
No, but they were always fun. They, I remember distinctly, when they all served at the same time. Good
That's
memories
pretty cool.
amongst them, right?
Yeah, that
so
is.
Being a part of it is pretty cool.
Yeah, that is. So let's jump a little bit to Haleon. So tell us a little bit about the company. You mentioned it was a spinoff of GSK.
Yep.
What does the company do, and what are maybe some of the products or brands that we would probably be familiar with?
So we are a consumer packaged goods company. We are known. You probably don't know us by the name, but you know us by the historical legacy brands like Advil, Flonase, Sensodyne, Tums. We are exclusively an over-the-counter business. We are in 5 categories across the board. So in oral care being the biggest part of our business. We are a British-based pharmaceutical. So our main headquarters are in Weybridge, which as part of that we have a satellite office in London. So
Okay.
you know,
All right.
but in the U.S. we're based out of New Jersey, and so our goal has always been to deliver everyday health with humanity, right, at a price point that is affordable for working class families. Unlike our friends in the RX space,
Right.
we don't participate in insurance programs. Our focus is primarily on making sure that the over-the-counter product that you purchase at your local pharmacy, retailer, is at an accessible price point to you and your family. So
Very cool.
we take pride in that.
Okay. And then you mentioned that your focus or your portfolio mainly is around oral health care right now. Is that?
So we have 5 portfolios, right? So oral care is our biggest, but you look at our vitamins and supplement business, our specialty care, our respiratory, right? So brands like TheraFlu
okay.
also me, Flonase as well, other products like Voltaren. Basically, you name it, we probably have something within those 5 categories that we have as part of our business.
Yeah, as you're talking, I'm thinking, yeah, I think I've seen that in my medicine cabinet
Yeah.
or my mom and dad's.
Right, yeah.
So, yeah.
And
very
it's
familiar.
fun. It's fun being a part of this discussion because I think we have I think 2 things, right? A unique responsibility and a unique role, right? We are immediately personal. You recognize our brands. You know what they do,
Right,
You're
right,
familiar
yeah.
with them. And at the same time, I think that translates for us the need to look at public health issues in a very different way because we've got to be nimble. We've got to be adaptable to our to the customers that we serve. My favorite part is that for us, regardless of your zip code, you will have an over-the-counter product somewhere near you, right?
True.
Because you don't need a doctor's prescription, right?
Right.
And the purpose for us is making sure that we have that pipeline of, products that are trusted, vetted by the FDA that don't require that doctor's prescription. And, we pride ourselves on the science, right? And being able to make sure that we deliver good, strong, positive health outcomes for families.
No, definitely. So talking a little bit about oral health and specifically. So I know we've had a conversation in previous times about oral health, and I think I've shared with you and others that I think we had at a briefing that my family and I were very familiar with the connection of oral health and just overall well-being.
Right.
So, growing up in a farm worker camp, we didn't have access to even good healthy water,
right.
For like a regular, like healthy brushing your teeth or anything like that. And because we didn't have insurance, the only time that we got to see a dentist or a doctor was when my mom qualified for that extra medical service. And then we would go to the dentist, and the dentist like, oh, love these kids. We're probably not going to see them again. So we're just going to pull their teeth. Because that was the way that they solved that problem, right? Because you're not going to see them again. We're not sure when we're going to see them. So talk to us a little bit about the overall oral health kind of crisis and how you're playing a role in helping people with that crisis right now.
So let's take a step back and I love your story because I think it is unfortunately common here in the United States. In the United States, 50% of Americans do not have dental insurance. And again, we could talk a little bit about how that works here, but I'm not going to bore you on the details. But largely, right, your health insurance is always separate from your dental, right, and separate from your vision. That's just how it is, right? And so 50% of Americans don't have dental insurance. 49 million people in this country live in areas that are underserved, with dental professionals, right? So that could be, something as simple as not having a dentist within, your immediate vicinity, right? It could also be a lack of a federally qualified health center, right?
True.
So it's tough because when you are in those areas, or if you're one of those 49 million, you don't have immediate options, right? And sometimes you depend on those, nonprofit groups that come into those communities to provide care, right?
And then every now and then there's like a clinic, a health fair, or something like that.
And sometimes that just doesn't happen, right? So what about those other people who might just not have access to those? We have data that show that about 2 million people every year depend on urgent services for dental care. The ER is not designed to provide dental care, right? And that's why you go back and it's like, bueno, ¿qué otra opción hay? Pues arrancar el diente, right? So not great. And I think in some ways, we have to find opportunities to reduce that problem, right? It's also not good, selfishly speaking here for yourself, right? Like, I don't think anyone wants to get their tooth extracted, right? I mean, have you felt the numbing? It's horrible.
Right.
But
not only that, but it like shifts your whole mouth. It shifts everything, and there's like, it's like a domino effect of other stuff.
Right, yeah, no. And as someone who has suffered from periodontal disease, you get tired of going to the dentist, right? Like, it's like, really? I don't like that smell.
Yeah, you're not the person I want to see on a regular basis.
Correct. You're my friend, but not really. Not
you actually become friends.
Right, yeah.
Right?
Yeah. That, like, I've hung out with my periodontist for forever now. Like, he has been seeing me since I was a kid.
You know what's crazy? So, when I was younger, working in Sacramento, going through all the dental stuff, because I was so excited to have finally, like, dental plus vision plus health.
You become a dental nerd.
Totally. So, it was interesting because our dentist, like our office family dentist that we all went to, was literally 2 blocks away. The joke was that I would go talk to him, and then you know what we would do afterwards? We'd go out for lunch. Because he really became a friend afterwards.
Yeah.
That's
they become
crazy.
Your family. Yeah. And let's be real, right? Like, I don't think I think dentists deal with a lot between people that complain and kids that bite you.
Right.
But,
and most people don't want to see you.
Correct. Yeah. But let's be real. 90% of systemic diseases manifest in the mouth, right? And so if you don't have, I mean, I sound like my periodontist. If you don't have good oral health,
so
correct, he'd be proud of me. You can't have good health overall, right? And so when you look at opportunities that we can, collaborate with when it comes to addressing, these issues, right? I think at minimum we should be making sure that people have an opportunity to have healthy teeth, to be able to get those screenings, to
Right.
find a doctor, to discuss their concerns, right? Even things as simple as dry mouth could be a bigger symptom of something else, right? And so,
Right.
I think when we look at where we fit in the healthcare system and how we look at advocating for public policy, we always want to find, those opportunities that are, feasible for families. At the same time, we recognize that dental care is expensive. You look at, and there's this old report from the NIH, but it talks about how every time, someone goes to the emergency room just for a tooth extraction because they don't have insurance, it can easily cost an insurer $900 to $1,000. That
Wow.
was way back when. Those
Yeah,
numbers
who
aren't
knows what it's
adjusted.
now.
Correct.
Yeah.
And so we do try, I think for us, when we look at trying to, create products that are accessible, we really emphasize that need for there to be, a preferential opportunity for, say, for example, toothpaste to address sensitivity, or toothpaste designed for gum disease, right? And so, looking for those opportunities has been a big opportunity, a big focus
Big
for
focus.
us.
Wow. So it's a lot of the real costs that you mentioned as well. So what are some of the things that Haleon is working on to, one, educate people, educate the policymakers about it? What have you been working on? Because just as we just sat down for this discussion, you were sharing how busy you and your colleagues have been.
Right.
So share with the audience a little bit about the policy side of it and maybe how they can also help
Right.
in that.
So two things. I think I'll address the policy part, and I'll even tell you a little bit about how we're partnering with nonprofits in the
Yeah.
space, because the reality is that the nonprofits they know the communities better. They know the level of
Right.
need.
They're at
and-
the rubber meets the road.
Correct.
Right.
And they
right.
know where the deserts are, right? And sometimes, there's something to be said about relying on data and actually walking into these areas in real time where you realize, now I understand why families don't have this
Right,
access,
right.
right? Going back a little bit to your story earlier. And so I think for us, look, we look at we're actively looking at opportunities to make products like Sensodyne, products like Parodontax, Biotine, to become FSA, HSA eligible, right?
They're not?
They're not, and they aren't because of a 1957 regulation that says that toothpaste is considered a toiletry, right?
Interesting.
So, and we've been pushing for, the Treasury Department to, relook at this. We know that there's legislation out in the books,
Yeah.
but really I think we have to, and again, this is just government, right? Like government always is slower than.
It takes a while, yeah.
It's procedural.
Yeah.
And so, looking and kind of highlighting this, where it's like you've got a big deficit here. If you really want to make a significant change for families, including those that are outside of Medicaid eligibility, right? Because
Right.
there's a big, gap between people that can,
I'm just
depend.
fascinated that it's not part of the FSA and
Right.
HSA, because when you look through that, and
Right.
I go through mine,
Right.
there's all kinds of stuff there.
All kinds of stuff.
Like
right?
it never even dawned on me that
Right.
the oral health toothpaste is not even there as an option.
Right. Yeah. It's and the only way you can do it under current rules is by getting a prescription. However,
For toothpaste?
correct. And then from
Wow.
there, and what's not clear, right? Because it depends on who your benefit administrator is. They might tell you, well, you need a prescription every time you purchase this.
Oh my god.
So that's a burden on you.
You don't even need that with other medications,
Right.
because the usually it's like you can
Right.
get at least 2 or 3 refills.
Right.
Type of thing.
But if you're depending on over the counter, and if let's say let's pretend, right? Let's say I am a blue collar worker, right, with an FSA HSA, and I'm working a tight shift. I'm not going to go around and go to the doctor every single time I
No.
need a prescription
Yeah.
for something I know that addresses my
Right.
needs. So we do think that there is an opportunity there to update that regulation guidance to just kind of recognize that there are changes in the space. And so separately, we also look at working with nonprofits, right? And so we
Right.
have an initiative currently. We provide about $600,000 on a two-year grant basis for nonprofits that operate in areas that are, deficient with appropriate numbers of dentists, right?
Yeah,
Or areas
okay.
that have that.
The dentist deserts.
Correct. The dental deserts. Yeah, let's
Yeah.
call that. And look, like we've seen some great stuff. We've partnered with friends from Omaha to Puerto Rico, in which we make sure that they have the appropriate infrastructure in place, investment, just to be able to reach out to those communities.
Yeah.
Even if it's an outreach arm, you'd be surprised. You can have all the tools in your toolbox, but if you don't have an outreach arm that proactively goes out into those deserts, sometimes you just don't have people
Right.
that show up. So you always want that partner.
Yeah. Outreach used to be a big deal.
Correct.
Of every government program and initiative. And unfortunately, with the invention of the internet,
Right.
a lot of things have kind of been cut off from
Right.
a traditional outreach and engagement
Right.
to check on punto.com,
Right.
you know, and
Yeah.
not everybody
Right.
does that and
Correct.
even knows how to do that.
Right. And look, like we can talk about the powers of AI, right?
Right.
But there's still that innate sense of being human where sometimes we just don't want to get
Yeah,
help,
and if
right?
it's health related, you kind of want to talk to a person.
Correct. Yeah.
Yeah.
You want to, not a machine. I love
Yeah.
machine learning, but don't
Yeah.
tell me that I got dry mouth, right?
Yeah.
Like it's stuff like that. And so, shout out to Walmart. I know that they're also
Okay.
one of your collaborators,
Yeah.
but we have partnered with them and Remote Area Medical, in which we have provided about $1.6 million in dental care, right? And that's everything from the cleanings, the fillings, and even dentures, right? So,
Wow.
we've done that.
Okay.
And it's amazing when you check us out and you see the faces on these people when they realize that they can chew for the first time
Oh,
without
yeah.
pain.
Without the pain. Yeah.
Or that they just have like a
Right.
new experience with, just being able to talk with comfort,
Oh yeah,
right?
no,
These-
and I can also see, like, I've run into this before too, like, you can chew on both sides of your mouth, not just on one side,
Right.
right? Because or the dentures are off. We're dealing with that a little bit with my mom and dad right now.
Right.
And they're also calculating. Like my mom literally is calculating. There's certain things that her insurance will cover, certain things that won't. The dental office will help her calculate it, and then of course, her favorite nurse just left the dentist office who knew everything, right? So
Right.
it's a lot for just an average person to
Right.
keep up with.
Right. And that's the power of community, right?
Yeah.
Just being able to have your known provider, have someone that you trust with your conditions and being vulnerable, right? Like, I mean, if you really think about it, not to sound like a therapist, but you are being vulnerable in the dentist chair,
You are.
right? You
You
are
are.
there and you're explaining your issues, and it's the sounds, it's the sensation, it's the sensory experience. And
Right.
we could probably save that for a separate podcast, but we've also been working on meeting diverse needs, right? And
Oh,
so
interesting.
making sure that members of the neurosensitive community have options that are consistent with their needs, right? Like, even again going to the dentist's office and hearing the drill,
Right,
And
right.
I mean, I think back to when I was a kid, I really, really.
I mean, that's
the
why some
dentist.
people don't like going.
Correct. And I mean, listen, even as an adult, sometimes I'm like, do I really want to schedule?
Yeah.
No. But
Yeah.
we got to do it.
We gotta
right?
do
We gotta
it.
take care
We
of
gotta do
ourselves.
it. Yeah.
So,
So share with us. You kind of tapped a little bit into this, but is there a success story that we should be aware of, or you mentioned the partnership that you have with Walmart. Any other stories like that that you can share with us?
I think if you look at our partnerships, and I mentioned two, right? Like I mentioned one in Puerto Rico with La Fondita de Jesus, or even the One World Community Health Center in Omaha, Nebraska.
Okay.
I think it's one thing for us to talk the talk and say, these are products that are good for you, you should use them. It's another thing if you go to these communities and look out for people and, remind them that, dental care is essential.
It is.
I think for us, there is so much more value in preventive care. We know how important it is across the board, and the data show it, right? Like an ounce of prevention is worth so much more, and it prevents unnecessary doctor's visits, procedures. And for us, look, in the over-the-counter business, we know that for every dollar that a consumer spends on an OTC product, it generates $7 in savings to the healthcare system.
Wow.
Again, reducing the need to go to the doctor unnecessarily, reducing
Reducing going to
unnecessary
an
prescriptions.
emergency room when that's not
Correct.
even what they're
Correct.
designed for.
Correct, because they
Yeah.
should be literally just for emergencies.
Right.
And so again, for us, it's really about empowering the patient, empowering the consumer, so that they have an opportunity to find a product that meets their needs,
Mm-hmm.
and at the same time, making sure that it's done at a price point that is affordable, accessible, right? And we don't. and my favorite thing about this part of the business is that we make a significant change in people's lives, and you can see it right then and there, right?
And people can feel it.
Exactly, right? Like, you just feel, you know, sometimes if you are like me, when you have your sensitive teeth, or if you have periodontal disease, or you've struggled with that historically, just knowing that you have a product that takes care of you.
Yeah.
Like,
that helps a lot.
It helps a lot.
Yeah.
And you know, you can coordinate your care with your doctor, and make sure that if you've noticed any recession, or if you've noticed anything else, like, you're able to have that open line of communication, you know, using the products that are backed by science.
You know, we have a dear friend who passed away with CHLI, Stephen Vermillion.
Yep.
We name our Congressional Staff Appreciation Award after him. But he ended up passing away from leukemia. He found out because the dentist appointment, that's how he found out that he had leukemia.
Yeah.
So, I mean, it does touch a lot of lives, and in a very, sometimes kind of a weird way that you wouldn't expect or you don't think about.
Right.
Because, again, unfortunately, we have like the vision, the medical, and the dental. It's always three separate things.
Right.
So you mentioned the partnerships with different organizations. You know, we've always enjoyed that partnership, you know, with the Congressional Hispanic Leadership Institute, yourself and Haleon. You know, thank you for that. And I'm curious what other organizations, you know, not just with CHLI, but what other organizations you work with, and if there's, you know, how you can identify if someone's listening or watching, if they have an opportunity maybe to partner with you as well. What are you looking for, and what does Haleon need to get the word out?
So I think for us, you know, you look at our base, right? I think the beauty of our product portfolio in the U.S. is that we pretty much, again, if you're somewhere, if you are an advocate for digestive health, right, or if you are an advocate on nutrition, right, our portfolio meets you there. If you're looking at alternatives to pain management, you know, that's us, right? I think if you look at, and this is the cool part about the OTC world, there are so many conditions out there that we address, and that we could do more, right? And so I think for us, it's, you know, if you happen to be listening to this podcast and, you know, you're in those spaces and you check us out and you're like, well, you know, we identify an opportunity, go for it, you know, reach out, we're here. I will also tell you that I think for us, we look at, we primarily work with the Consumer Healthcare Products Association, the Council for Responsible Nutrition. We also are members of the National Association of Manufacturers. I think for us, it's really trying to make sure that, you know, the conditions here in the U.S. from a regulatory, legislative perspective, are consistent with the needs of the consumer, right, of the patients. And, you know, again, I think for us, we've worked with the American Dental Association previously. We've had some great work with the folks who take care of migraines. So we run the gamut, right? Basically, if you can
You've been pretty busy.
Yeah, a lot going on. But look, I will tell you, if there is a reason you're using the product and you tie it to advocacy, there's a very likely chance that we'll give it a listen and give it some serious
So how
thought.
do people find out more about the company and or the products, those different kind of opportunities? What's the website or
So all of our products
campaign?
all of our products are on Haleon.com. We usually update folks on LinkedIn, Facebook, and Instagram. The most popular platforms, I think, are LinkedIn and Instagram. You know, everyone just loves scrolling.
Yeah.
And so you'll find us there. But I think if you want to learn more about us, you know, give us a follow and check out all the cool stuff we do.
Okay, cool.
But no, listen, look, we always appreciate the partnership with CHLI. We are always delighted to see the work that you're doing with so many of these kids, whether it's their first time in Washington, getting their dip in the public policy world, or even your law fellows who are looking at, you know, having a career, you know, doing regulatory or legislative work. And again, you have a special place in our heart. You have a special place in mine.
Thank you.
And so
Thank you.
we look forward to, you know, staying as partners.
Well, again, Jonathan, thank you so much for joining us on the Purple Line and for sharing with us everything that Haleon is doing and how we in the community can also help for the good health of everyone.
Perfect,
So thank you again, and we'll see you around town.
We'll see you in the next podcast.
All righty. Thank you.
Thank you.
Thanks for listening to The Purple Line. Follow us on social media at The CHLI, at THECHLI. Thank you for joining us on The Purple Line.